Hi there, Tom here from Target Physio. I'm currently doing some postgraduate study through the University of Edith County University in exercise medicine for oncology, and came around this awesome paper titled "The Effects of Exercise Therapy in Cancer Patients Undergoing Radiotherapy Treatment," which was a narrative review. It's quite a long review, about 17 pages, and basically it showed that, as we know, fatigue is one of the most common symptoms reported by cancer patients undergoing radiation therapy, and it affects more than 65% of patients. Cancer-related fatigue is defined as a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion. And it's also not necessarily proportional to recent activity and it interferes with usual function. Cancer-related fatigue progressively increases in severity over the course of radiation therapy. So some of the summary of this article is that exercise should be considered as a concurrent treatment alongside radiotherapy to alleviate treatment-related side effects and to facilitate an effective recovery. Due to the onset and progress of treatment-related side effects throughout radiotherapy, regular clinical evaluations are strongly advisable in order to continually adapt the exercise program depending on symptoms and side effects. So the studies basically confirmed that supervised sessions were better than home-based interventions. And exercise professionals needed to personalize exercise training based on the medical condition and tailor it throughout the intervention according to the progress in the patient's medical status. And that's often because people will experience more fatigue during their course of radiotherapy. In terms of prostate cancer, which is a cohort that I see a lot of men with prostate cancer, an exercise program performed during radiation therapy in prostate cancer patients is associated with high adherence and satisfaction. A worsening in cancer-related fatigue, which is one of the most common side effects reported in prostate cancer patients, is preventable with exercise. And the level of fatigue reported was universally associated with the physical activity level. So basically, the more active someone was, the less likely they were to be fatigued throughout most of the studies. And so exercise training, which is also great, it also improved exercise capacity, exercise function, and muscle strength, and decreased their level of pro-inflammatory cytokines. And so this is really, really important stuff because this great little slide which was included in the study. And we can see here, so this vicious cycle of fatigue. So if someone's fatigued, they often are more sedentary, leads to physical deconditioning and muscle wasting and loss of function. And then that also affects quality of life, sleep disturbances, psychological distresses, and energy. And if we put in exercise in any of these corners here, it would make a significant effect to breaking this cycle of fatigue and improving quality of life. And also in terms of deconditioning and sedentary behaviour, also preventing secondary metabolic conditions. So that's my study for the week. Thanks, guys.